Um, Good afternoon, good morning, good evening, wherever in the world you're watching us from. Welcome to Black Mental Health Matters. I'm your host for today, Nasasra Claire from Uganda here, and I have two guests, one from Nigeria and the other from Uganda. Um, from the Taruka National Environmental Hospital. Grace, introduce yourself.
Yes, Claire?
Introduce yourself. There's a very new background.
Oh, there's a very in my background.
Yes. Yes, it has been reduced now. Um. Today we are going to be discussing
think
Uh,
there's still a
there's
noise in
still
the
a,
background.
there's still a noise.
Yes,
Yes,
sir.
yes.
Oh, let me see. Let me see how I can avoid it from this. Can you give me a few minutes?
Yeah, sure.
Thank you.
As we give Grace something, um,
It's a lot of noise. This guy is making a lot of noise. See. Keeping
Zion, I see hearing that noise.
I think it's a lot better. I think we can just go ahead for want of time.
Yeah.
If you just manage it while he tries to sort it out.
Yeah. We are trying to wait for Grace a little bit, but we are going ahead with Zion as we discuss the impact drug and substance abuse on mental health.
The
Um,
central market. Huh?
Zion, if I may get to you, can you explain for us what is addiction? What does addiction mean in short?
Okay.
Yeah, sorry, I have removed Grace from the studios because of that noise. We can go ahead, Zion. Find for us what addiction means. What does addiction mean to you? Someone says I'm addicted to a drug, to a substance. What exactly do they refer to?
Oh, okay. Thank you very much. You see, when we talk about addiction and in this context, um, to drugs, it simply means that the individual is now beginning to have disorders or concerns around the subject matter of drugs. That means he is now susceptible. He's now like almost being able to function optimally at the expense of drugs. So when somebody is considered to be an addict, which I feel is a word that is already gradually being talked against because the word seems to be a bit harsh. I think, in other words, instead of addict, maybe we can refer to a dependent. When an individual is beginning to be said to be drug dependent or dependent on a substance, it means that this individual is only able to function optimally or live his life at the expense of the intake of drugs or substances.
Okay, thank you, Zion. Grace, you've been away. Welcome back, and thank you for bringing down the sound. So, if I may get back to you, kindly define for us what addiction means. If someone told a lay person, "I'm addicted to drugs, I'm addicted to alcohol, I'm addicted to marijuana," what is the other person supposed to be understanding? What is addiction in short?
Yes, thank you so much, everyone who is here, and I welcome you onto this show. Uh, Literally, I want to inform everyone that addiction, in a layman's language, is when someone can do something and persistently does not stop. So, different people are addicted to different things. Hello, can you hear me?
Yes, we can hear you.
You can hear me? Okay,
Yes.
Yes, sir.
so in a layman's language, addiction is a habitual, psychological, and physiological dependence on a substance or practice which is beyond voluntary control. Uh, I think you know what I'm meaning here. It is a habitual and then psychological and physiological dependence that is beyond control. So meaning that it reaches a state where it is involuntary. Someone does an activity or a habit and it becomes involuntary and he has to do it repetitively.
Okay. So in the case of someone, because we understand there are a couple of substances or drugs that people get addicted to. Well, for my sake, I may understand there is marijuana, there is cocaine, there is alcohol, and maybe also some people get addicted to sex. They get addicted to so many things around themselves. Even people get addicted to food. So in that case, if I may ask, is there a medicine that someone's supposed to take to overcome the addiction, or it is something that's incurable?
Yeah, you see, what I would want to put forward first is addiction affects every person. It affects people from all walks of life. But what I would want to tell you is there is no particular medicine that is given to a particular addiction. In most cases, people are treated through psychological, but also when people are addicted to different things, they are taken into treatment, and treatment is a broad thing, you know? So, meaning there is no particular medicine that can cure addiction, but is something we can manage. It is a chronic disease, it is a disease of nature, and something that can be worked on and someone can be treated just like another disease like diabetes, which is chronic, and another chronic illness. So it can be
Yes.
managed and treatable. Yeah.
So as I'm getting back to you, as Grace has put it, these addictions can be managed and treated. So
Yeah.
can you really maybe highlight for us some of those addictions that can easily be managed and controlled? Because me, I have seen some people who have failed to do away with these addictions. So you,
Hmm.
as a mental health activist, can you please maybe highlight for us some of these that have been treated or managed and people are doing well with them?
Okay. I can see get some noise interference in your communication, but I think if I understand what you asked is maybe some of the addiction, whether they are, are totally treatable or something, just like Grace has mentioned. They are absolutely treatable, especially if they are being attended to on time, if they are being discovered on time. I give an example, like for us here in Nigeria, statistics, have it that overall 1 in every 5 drug user is dependent. 1 in every pharmaceutical opioid user is dependent. Are you following me? 1 in every 3 cannabis user is dependent. Now again, we also have it for those who also are dependent or addicts of amphetamine. 1 in every 7 of them is dependent. Now, does this mean that all of these people who are dependent can no longer function normally, can no longer have their lives return back to normalcy? Absolutely, they can actually return back to normalcy. I believe that drug problematic use or disorders can be treated. Okay. it's also very important that I'm going to make it more inference to Nigeria. Okay, like as we have it today in Nigeria, more than 80% of high risk drug users,
Mm.
right, have severity of dependence. Okay, that will require some intervention to address this problematic drug use. So that's to tell you that with this high population of people with dependency on drugs, it is also very important that we establish that they can enjoy some form of interventions that will help this problematic drug use. Thank
Okay.
you.
Okay, thank you. Getting back to you, Grace.
Yes.
Kindly highlight for us some of those addictions that have been managed in reference to the place where you work, where here at Butabika National Mental Health Hospital.
Mm. Yeah, you see, addiction, as he has put it forward, there are so many types of addiction, but you find that most people have stigma with different types of addiction. And currently, in hospitals and national referral hospitals, we are focused mostly on alcohol and drug use and then substance use at large, the marijuana, heroin, cocaine. But however, people are addicted to different addictions like sex addiction, masturbation addiction, pornography addiction. These are rarely managed, and of course, these are managed into individual basis and individual counseling. But we manage more of this drug use into in-house treatment, or what we can call inpatient, and then community intervention. So we manage more of substance use addiction than more of other types of addictions, though we manage others through one-on-one counseling and individual approach.
When we talk of managing, because
Yeah.
ideally, I have been able to visit the mental referral hospital in Uganda, and I see one of those that used to manage by doing rehabilitation. We rehabilitate these patients for a certain number of months for them before they can go back. Is that the
Mm.
only way? Is that the only way these patients can be managed? I mean, the condition can be managed, or there are other ways that they have to undertake in order to manage the situation?
Yeah, you see, Claire, it depends on which type of the patient, and patients are managed differently. So, what am I meaning here? There are patients that come with different psychiatric comorbid conditions. So, when they come into hospital, addiction and substance use is related to mental health disorder. So, many people come in with other related mental health disorders. So there are people who come in either with the substance use comorbid to psychiatric condition, or those who come in with the psychiatric condition but they started taking substances. So in actual sense, we have to rehabilitate them and work on the psychiatric issues and also work on addiction. So the best treatment could be in-house treatment. And also, the best treatment in addiction is detox. To begin, the stepping stone or the starting stage is detox. So you can't start working with a patient who has been on cocaine, heroin, and then you've not put him in a hospital, because some of these need comprehensive health management. Yeah.
Okay.
So you find that hospitalization would be the first stage of managing someone with substance use problem.
Okay. Uh,
Yeah.
getting back to getting back to you, Zion, I want to ask you something that Grace has addressed earlier on. Like you said, addictions which are not usually worked upon, which are not usually managed. Addictions like sex, like masturbation, such addictions are always underlooked for some reason. I don't know why. How do you as a mental health activist in Nigeria, how do you go about that? Do you give them a listening ear? Do you also deal with them the same way Grace does it with Uganda and these other people? Or how do you do it?
Okay. Thank you very much for that question. I like to I'm going to make some few points to what my friend Grace just mentioned with respect to the treatment for drug dependence persons. But let me quickly attempt to answer the question you just asked. We just finished a program with United Nations Office of Drug and Crime, a 14 month program, which is drug dependency treatment and care. One of the alarming things that I found out from that program is, you see, it's very important that we get to understand that it's not about criminalizing drug users. It's not about legalizing that. Look, these people have to pay for all of these acts that they cause the society or in their environment or in their communities. But largely, I think it's very important that I put it in this show so that our audience, across the globe will understand. Because this issue of drug is not just only in Nigeria, it's not just only in Africa, it's across the globe. It's very important that we have a change in narratives on how we view drug users. I'm not here to maybe hold briefs for them. I'm not trying to like say, okay, look, we need to pamper them. We need to no. But I want us to begin to look at these drug issues from a health perspective. I want us to begin to look at it that look, it's really a serious health matter. As a matter of fact, if it is not being managed and well cared for in no distant time, drug issue is going to become a very serious pandemic that will be causing a lot of havoc, not only to the health sector, but across board, right? So, I mean, by the time we refuse to give attention and manage these drug issues, the impact of it will not only be speaking to the mental health of the individuals, but I can guarantee you the impact of this drug problematic use in our community, in our society, in our nation, our continent, across the globe, will begin to infiltrate and affect even the political sector, the economic sector, every other sector. Hence, I would like to let me just sum my point on this point. That let's begin to view the issue of drug problems across our communities as a health issue, much more than just a criminal issue, much more than just an issue that we need to stigmatize or discriminate, right? It's very critical that we begin to view it from that perspective. Thank you.
Okay, thank you then for that. Getting back to you, Grace. Say that in the coming years, drug abuse and substance abuse is going to be a pandemic. If
Yeah,
nothing
yeah, yeah.
serious is done, we are going to be in a lot of pain, in a lot of serious trouble. So, you as a psychologist and as an addiction professional, I mean, where do you see this going? Do you people have this idea that you can see to bring forward to ensure that things are tackled, or are we only going to work with what we know?
Yeah, surely, as you put it forward, I want to tell you that my colleague is mentioning it. He's knocking it the nail on the head. If we don't address the problem of substance use and drug addiction, we actually it's going to become a pandemic more than even coronavirus. Because I mean, there is a lot that it has changed the whole world. Addiction has changed. People are addicted to different things. People are addicted to substance. People are abusing drugs. The youth are abusing drugs. And then there is a lot of distortion into social functioning, occupational functioning. There is a lot of jumping out of schools, and then a lot of crime increase in crime rates in Africa and other countries across the globe. But what would be to answer the question, what would be the way forward? Currently in Uganda, yesterday I was addressing a youth conference, trying to train them and doing prevention on substance use. But also we've come up with different chapters. We have what we call ISAP. ISAP is International Society for Substance Use Professionals. And this is all, I know everyone who is here is well versed with ISAP. And then we're coming up with the different groups of people who are addiction professionals. To address this pandemic is we would want to stop people who are also into addiction and they are actually damaging. Just like how someone can come and say is an addiction specialist, is starting to treat addiction, and in actual sense is damaging. So the way forward is come up with a critical team, come up with professionals, come up with different professionals in different countries in Africa so that we address this pandemic. But also prevention is a key in schools, in communities, and in institutions. Thank you.
Talking about training more addiction professionals, then I'm getting back to you. I understand. I'm going to give an example of Uganda here. So many people who want to do medicine courses, most of them do not want to specialize in psychiatry to do anything with brain disorders. They want to do this other medicine, heart surgery, these other things. So, I mean, what plan do you have, or what have you tried to find out about people getting more interest in studying these courses so I can be able to help people who are suffering from such addictions ahead? In Nigeria, what are you doing about it?
Okay. I'm still struggling with some of the background noise. I'm not able to really filter to hear you, but I want to assume that you refer to how other professionals in the health sector prefer to to go into some of these expert sectors in the health industry than maybe psychiatry or maybe drug. Is that what you mean, ma?
Yes, 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 yes.
Oh, okay. You know what? One of the things that I might have to say to that is generally, anything that cut across mental health, drug substance abuse across the globe, there's no attraction, there's no passion, there's no why, because it's been considered that beginning from the remuneration that comes to people or professionals in that sector, the kind of life that they can enjoy, the kind of income they can receive from their services. Okay, the kind of association they can enjoy with their fellow experts. It's not there. I have seen in a couple of times at the course of our advocacy, both at state and national level, where people stigmatize psychiatrists, where
Yeah,
people stigmatize people who are experts in managing drug problematic issues. So
issues.
this tells you that even within the health sector, now we're not even taking it out of the health sector, within the health sector itself, we have found that other professionals seems to stigmatize, seems to derogate, seems to discriminate professionals from this particular mental health field. And this is one of the reasons why we are saying that across Africa, across the globe, we are having severe deaths of professionals in this sector. We are not only, I mean, yesterday, for example, we had an African mental health reforms webinar where we try to see how we can engage advocates and professionals across Africa to see how we can drive home the issue of mental health reform. But then, how many professionals do we have in Africa? Some of the countries, like Sierra Leone, we scarcely could get one or two persons that will align with what we're doing. In some of the countries, you can count the number of mental health experts on your hand. I mean, would you just do your fingers like this?
I think Zion's network has been affected. Grace, can you hear me? Grace. Zion, hello. Are you getting me? Hello. As my guests are approaching to come back to studios, I would like to tell you that mental health addictions is something which is very serious, both in Uganda and in Africa as a continent, and a lot has to be done to ensure that these addictions are being dealt with, are being tackled in a right way to ensure that to ensure that Grace will come back. Hello, Grace.
Yeah, I don't know what happened. Thank you.
It was a network problem. I will come back. Grace, now I want to ask about something concerning some new clinic that has been brought to the hospital, a clinic called medicine assisted therapy, which is called MAT. What exactly does MAT do as regards to addiction?
Okay, Matt, I think so many people have not known about what MAT does, but MAT is a component of treatment in substance use treatment. It is just a part of a component of treatment where mostly we target or treat people who are opioid users, people who are using opiates and those who are injecting drugs. For example, injecting drug users, those who are using heroin by injecting. Currently, we are concentrating on only those who are injecting at the moment, as per, of course, the funding proposal. But with the time, we shall also concentrate those who are not injecting if granted permission. But medication assisted, MAT is medication assisted treatment. Are you hearing me, right? Okay.
Yes.
MAT, great. MAT is medication-assisted treatment, so meaning that MAT has a component of different treatment approaches, where we also, when someone comes onto treatment, these mostly we target outpatient treatment. This is now the MAT as a clinic, and these patients come for their drugs or drug refills daily, So, and mostly, as I say, it has a component of psychological intervention, social intervention, and counseling as a broad. So it is a broad way of treatment and a part of treatment that helps people who are using substances. Yeah.
Welcome back, Sophie. We are sorry we had lost you earlier on, but welcome back. So, Azan, I want to ask you about something called implants. Yeah, mental health activists are talking about this. Lately, I was reading someone, they told me that people who are addicted to alcohol, there is something called an implant that is put in their blood to reduce the presence of the alcohol. How does that one work? How do implants work in regards to controlling the cravings?
Can you help me just go over that question again, please? Please.
there is something called implants. These are implants that are put in the alcohol addiction's body. It's an addictee of alcohol. An addictor of alcohol. They put in that implant from someone who craves alcohol all the time to reduce the need from the craving. And I'm asking myself, how do they work? Because I may understand implants as a woman, as something that it's used as a way of family planning, but if it comes to controlling cravings, how is it being used? How does it prevent the cravings, in short?
Okay. Maybe I might have to allow my colleague to respond to that. But let me quickly say that in terms of maybe approaches, different approaches to curtailing drug problematic usage, it's also very important to consider the body makeup of the individuals, because there are just like normal medications. There are some medications that I might take and they wouldn't come with any side effect for me, but when another person takes them or when another person uses them, it might come with the person might come down with some side effects. So like this you are referring, I'm not very familiar with it at this moment. I might not be able to speak on it, but I feel it's very important that whatever form of approach we want to adopt, in terms of managing or solving the drug problematic disorders, it's very important that we take cognizance of our body makeup. We take cognizance of our genotype. I mean, everything about us, because we have seen in some cases when we go out to sensitize people in communities where they tell us that okay, this person went in for rehab, but it seems it's getting worse. Okay, so it's very important that we also are very careful to knowing what kind of treatment or what kind of centers or facilities we expose ourselves to in search of treatment for some of these drug problem disorders.
Okay. Getting back to you, Grace.
Let me push it to my colleague, my wonderful friend,
Yes. Grace,
Mr. Grace.
I asked something to Zion, but he said you can answer it better. Something regarding implants. Yes, I
Yes.
got some, there's some information that I got about uh, alcohol addictees
Mm,
being injected in an implant to help
mm,
them with the cravings, to reduce the cravings of the alcohol.
mm,
How
mm.
do those implants work? Because ideally, as a woman, I'm using implants as a family planning method. So when it comes to drug addiction, how do implants work?
You see, I want to put this forward that so many people have come up with different myths about how the implant you're talking about works. And the same as implant is a part of treatment, which is also under medication assisted treatment. And this implant you're talking of is called naltrexone, if I'm not mistaken, naltrexone. So
Yes.
naltrexone, just like any other drug, as you talked about the MAT clinic, we have different types of drugs used to manage someone who is using substances. So naltrexone as an implant is also a drug that is given to someone who is abusing alcohol. But I would want to put it forward that it's not a magic bullet. That if someone is put in an implant, is not going to drink. No, it depends on someone's cognition. You have to do a lot of psychological intervention, and someone has to be aware of it and has to know that, when I put in an implant, I don't need to predispose myself to alcohol or any substance. But how does it work? Implant is an antagonist. An antagonist means that if you given that implant, it will block
the effect, the desired effect, that maybe when you take alcohol, you feel good, you know, you feel so nice. So when you given that implant in a layman's language, is it blocks the receptors, and the desired effect that someone wants to get after taking alcohol, after having that implant, you rarely get that effect. So at the end of it, you may not have a reason why should I go for drinking, you know. So because it has blocked the receptors, that might also help to reducing of cravings. But as I said, it depends on the individual, and it depends on thoughts, cognitive behavior. It depends on how one thinks and how one takes it. But if someone is psychologically prepared and counseled, this can work. Yeah. And we're using it in our national referral. Sure.
So besides these people who are addicted to drugs and substances being put in rehab, what other measures are being put in place to ensure that they do away with the addictions?
You see, as I said, rehabilitation would be the best measure, but there is no single approach, you know, or there is no single treatment that is imposed on an individual, or no single treatment that is imposed on someone who is abusing or using drugs. Different approaches can be used. There is the community model, you know. Several times I've used the community model where you find someone in his home, possibly manage, this may not be medical, but psychological, you know, because the cravings and all of this is more psychological. Then you manage that person through home. But as I said, the first and the best treatment model would be hospitalization. That as the first stage. Why? Because if someone is managed at home, and we have not addressed the withdrawals that this person is going to go through medically, we are going to affect this person. You shall end up impairing the person. I mean, the person may end up going into withdrawals that can even end his or her life. So the best model into addiction treatment and managing someone with a substance use disorder, the first stage is hospitalization. After that, we can go community model. We can look for these patients at home, talk to them, and continue with counseling. So as an addiction professional, Claire, yeah.
So in a case where a patient does not have money for transport for them to come here to the hospital, or maybe the closest hospital where those services can be offered, what kind of advice do you offer to such a person?
You see, it is quite tricky, but what I would offer to such a person is possibly looking for the nearby health center. But also, I want us to be careful that there are stages of addiction. There are stages of substances. There are stages where someone can start abusing substances and is not yet at the possibly third level. Or when someone has no other psychiatric comorbid conditions. Or maybe when someone has just started and the best treatment would be just to be really psychological. Okay, so if we are to refer any patient, I would first want this patient to be assessed by a qualified addiction specialist, by a psychiatrist or psychologist, and then find out what is the best way. Is it going to hospital, or is this person suited for home-based care or for hospitalization? Because if we just say that someone has no money, someone has this, so has to be managed, then we shall end up mismanaging the patients. And this is why I'm doing my PhD in quality of care.
So doctor, looking at some of the ways that WHO is looking at to curb down the addictions, most especially alcohol. I saw somewhere where they say the increase in the prices of the alcohol can curb down the addiction, so these people are unable to buy the alcohol. But then look at cocaine, look at marijuana. These things are mostly brought into the country when these officials do not know about it. So what do you think is going to be done in the long or short run to ensure this, that as far as you're dealing with alcohol, increasing the prices and all that, taxing all these things, how will you come to reduce the consumption of marijuana, cocaine, heroin, and all those things that just come into the country that these people are knowing?
Yeah, this is also something that we should really be keen of. You know, reducing the intake is different. You know, sometimes policies are there, policies are made in countries, but policies are not implemented in different parts of African countries. I'm sorry to say so. Maybe in Nigeria, there policies are implemented, but sometimes African countries put up policies and implementation becomes a problem. You know, so regulating substance use may be difficult because this is the part of income to some countries. Some countries are earning a lot of monies and billions out of it, but still it is a damage to the health. So what should we do? So I think we should advocate more, put more policies that and then put this more into higher authorities, and then put measures and legalize substances, legalize the taking of substances, and also ensure that we psychoeducate and also inform the community about the dangers of these substances, and also empower the police or empower other bodies that can help us to combat this problem.
Okay. So when you talked about, you've been using the word we should advocate for this, we should advocate for this, we should empower. When you say we in quotes, who are you referring to exactly? You, the
No, I'm
medics?
referring to no. Actually, I'm referring to those who are concerned, the policymakers, the medics, the substance use professionals, the social workers out there, and any other community. Africa, the president are part of it, and as I said, the policymakers, the president, the cabinets in different parts of African countries, they are really responsible for this, and we have to be one team. If we leave it for only medics, then we are ready to face the pandemic, and this will be worse.
Zion, welcome back. I'm putting this question forward to you also. I was asking Grace that WHO is actually working so hard to ensure there is a reduction in consumption of alcohol in the country by talking about increasing prices of alcohol, so that people, it is taxed so high and then the prices are so high, so that people who are addicted to it cannot afford to buy it. But I'm looking at it on this angle. There is cocaine, there is marijuana, there is heroin. All these drugs, people get addicted to them, and most of these, they are brought into the country behind these people. They do not know these drugs are actually in the country, unless they do some kind of hookup. So, I mean, as we go forward, yes, we are looking at alcohol. What about these other drugs? What do you think needs to be done to ensure that, as well as we are looking at the increase of prices of alcohol, should we also increase the prices of these heroines? Should we, I mean, what should happen? Because I know that ban has been tried before, but it has failed. So what's happening? What should be done? What's being done in Nigeria to ensure these drugs consumption lowers?
Okay. Maybe I might attempt to answer or respond to your question from this perspective. We might consider the demand reduction approach. Okay, we might consider driving or maybe laying more emphasis on the demand reduction approach as against what we have seen our African government do, which is the supply reduction. And we have seen that over time, even in developed countries, this approach has not successfully yielded results. We have seen that much has been committed into supply reduction in terms of trying to control the consumption or the production or the cultivation of some of these drugs or substances, but it haven't yielded the desired outcome. So for me, my opinion will be that our government and the stakeholders in these affairs should see the need to at least change the approach and be a little bit more committed to demand reduction programs. And I can tell you, you see, it will really help. It will really help. Why I believe is because, you see, the war against drug is a very expensive one because of the caliber of persons who are involved at the front line. Now, to completely say, either through legislation or through policy, to just stop the production or prohibit the possession or the trafficking of this, it's as fantastic as that is, as doable as that is. I can tell you that it might not give us the desired result. And that's why I said earlier that it is very important we begin to have our African leaders, our religious leaders, our community leaders to begin to see the concerns around drug issues and the impact thereafter as primarily health issues. This will help inform, our policymakers, our religious leaders, the government in itself, to take up a better approach that will help control the issue of the cultivation, the consumption, and the trafficking and possession of drug and substances.
When you talk about when you talk of a better approach, what exactly are you referring to?
Yeah, the best approach, I think, is the demand reduction. Okay. Yes, the supply reduction is fine. Okay, let's come up with policies that will prohibit people from cultivating. Let's bring up policies or plans that can stop people from being in possession of some of these drugs and substances or trafficking them. Fantastic. But you see, every human, every individual, basically all of our activities originates from our ideologies. All of what we do or engage originates from our mindsets. So for me, the demand reduction, I like to see it from the perspective of increased and focused sensitization and advocacy, where we will have these people who are grossly engaged in this act, to have them really understand the ripple effect of drug usage, not only to themselves, but how it affects their immediate family, how it affects the society, how it affects the state at large. Let's get them to understand the ripple effect of, look, what you're doing, you're not only, it's not just a crime, it's not just something by constitution that is illegal, but it's something that you as a person, it will truncate your living on this earth. We only have this our body, this our flesh, to be able to transact or to do anything on the earth. So if you're going to be taking in substance or drugs that will affect this body that guarantees you interaction and ability to live and function on the earth, then it is going to be it's abysmal. So it is very important that for me, we intensify the sensitization and advocacy to this population, so that they can understand what exactly and how exactly they are not only hurting themselves, how exactly it is not just about the money they can make from drugs, how exactly it is not about and the feelings they can get and how they can interact or maybe behave or maybe act. No, it is beyond that. Let's get them to understand that, look. Let me allow my brother to say something. I think he wants to interject.
I think that is what the point I was driving to, that the most important thing is our countries should carry out a lot of efforts governments, international organizations, and then non-government organizations to suppress the illicit production and trafficking. That is what I would want to sum up that point, because there's a lot of trafficking of these drugs. People are getting billions of money. I mean, even I'm sorry to say so, maybe other big dignitaries, maybe, quote me right, maybe other dignitaries in the either army or in forces gaining through this, we don't know. But if we put strong pause onto illicit production and trafficking and distribution of these drugs in different countries, we shall have tackled the problem. So that is demand and supply.
Okay,
let me just quickly say, I'm Claire. Let me just quickly add. You see, why this conversation is so important and very apt for me is, you see, West Africa as it stands today have become and have remained a key transit point for drug trafficking. And until we consciously, as citizens, as a government, as non-governmental, in fact, as everybody, until we consciously begin to act, this is going to become a problem. You see, until we put it to the African government and to all the non-state actors, this is going to become a very, very serious problem. So this is. I just felt I should add this to what my brother have said and that I've said earlier. Thank you.
Okay, okay, thank you, Zion. Actually, earlier on, Dr. Onati commented, well, she said that churches too, lots of addictions are not talked about in churches, which means there is less sensitization about what could happen in case someone is addicted to drugs. And now I'm going to ask you, Grace. I remember during a lockdown, I talked to someone from the referral here who said he'd been doing outreaches to ensure that to reach the masses and teach them about how to go about their mental health issues. So when it comes to addiction, what have you done, you as a mental health here in Uganda?
I think we have to appreciate first and foremost, and whenever I talk about addiction, in Uganda, I don't always forget about what we would call the father of addiction, and that is our former director, Dr. David Basangwa, is the father of addiction in the country, and is a person who has, trust me, put this at a higher level. What we've done is a lot is going on even right now. We are doing a lot of intensive training of health workers towards treatment. We're doing a lot of intensive training into peer support counselors, social workers, training them on how to manage different people suffering from addiction. Even the counselors, the psychiatrists, because not every psychiatrist is an addiction specialist or professional. Not every psychologist is an addiction professional. Neither not every social worker or counselor. So what are we doing? Like the national referral, we are doing a lot of trainings and empowering so many people. But also, as I said, we've come up with an organization in Uganda particularly. I am sure Nigeria, they have it, I'm aware. Okay, the ISAP, which is International Society for Substance Use Professionals, that will bind us, and then we tackle the problem together. But also, we have gone ahead by sensitizing different areas. We've gone ahead by doing red masses, talking to the radio, and I believe we shall do this so that we tackle the problem highly.
Okay. Putting this same question to you, Zion, what are you doing in Nigeria to ensure that you sensitize the masses so they get to know about drug addiction, how dangerous it is to their mental health?
Okay, thank you a lot for that fantastic question. One among other things that we do here for us at the Mandate Health Empowerment Initiative is to see, we believe that the African society is a very religious society. We understand how very religious inclined we can become, how extreme we hold the religious community. So one of the things we did, and we are still doing, especially as through the partnership we're enjoying from British Council and the United Nations Office of Drug and Crime through UNDP, is to ensure that religious leaders, okay, traditional leaders, okay, all the gatekeepers in the community or societies, the media, and teachers. Now, these are five critical stakeholders that we're dealing with. We try to ensure that we run periodic trainings for them, helping them to understand what exactly is drug and substance abuse in Nigeria. What exactly is drug usage, drug dependency? I mean, we try to there are several modules of these trainings, so we try to educate them at the commonest way that they can understand this. Now, why we are using this approach is because when we get to communities, people will easily or preferably want to listen to their traditional leaders, want to listen to their pastors or their imams, want to listen to people they are familiar with, okay, to accept whatever message they're going to give them. So, in that wise, if we go to communities and we spend 6 months, and by the time we're doing our analysis, we're seeing that the impact for this project is very low. So we said, oh, I think the best way is to engage these people who they believe, who they respect, and they listen to. So that is one of the things we're doing to ensure that there is an increased awareness and knowledge-driven activity to these uh, key stakeholders, so that they can help us carry the message, so that they can understand what exactly is in it and how it is very harmful and dangerous to the mental health of their citizens or their congregants, so that they can be productive. The bottom line for me, why I'm so much interested in this, is because until the optimal, until the mental health of Africans or any individual is optimally considered, it is going to be abysmal to expect optimal productivity from that person. So if you're expecting productivity from Africans or from people around us, and we do not care to invest in their mental health, we do not care to look out for risk factors or for things that predisposes them into endangering their mental health, then there's a problem. And that is why I'm so happy with this topic today, because drug and substance abuse is one of the major criteria or major risk or major things that infringes the mental health of individuals. Thank you very much.
Thank you for that, Zion. I see as so many comments have come in as regards to our topic, and some people have appreciated what we put through, what we put forward today. I see Joseph Samuel who says that's great. I see Dr. Onati who saying great topic. I see so many people. Thank you to everyone who's tuning in, who's watching us from wherever in the world that you are. And also, Zion, thanks to your daughter who's listening to us. She's learning something. We have there's one moment that I need to say to the end of the show. So I'm going to give you, Grace, a chance to talk to viewers and listeners, give them your last words as far as to drug and substance addiction is concerned. And yeah, I'm going with you after you.
Thank you so much. And I want to appreciate for this short time we've had sharing on this. And I would want to assure you that maybe at our age, but in recent decades, recognition of occurring mental health disorders among people with substance use disorder has been growing. That is one positive thing I would want to appreciate. For example, people didn't used to recognize treatment of addiction people didn't use to recognize treatment of people with mental health disorders, but at least there is a gap that is being bridged. So let's continue on to this, all professionals on here. And we should know that addiction affects people from all walks of life, and recovery is attainable. Your loved ones, if your loved one is suffering from substance use disorder, if your loved one is suffering from mental health disorder, please never fail to seek for help. Thank you so much, and we keep in touch and keep the professional growing. Thank you for listening, all people from Africa, East Africa, and all over the world. I thank you.
Thank you, Grace. Zion, you can give in your last comments, the viewers, the listeners around the world about the drug addiction. Zion, are you there? Zion, are you there?
Always seems to be on internet.
Yeah, so we seem to have lost Zion, but that's what we had for you today as far as drug and substance addiction is concerned. We thank Grace Bikumbi, the clinical psychologist and addiction professional at Tavika National Mental Referral Hospital. We thank you so much for your contribution towards this program. And also we thank Zion from Nigeria. Zion is a founder of Mandate Health Empowerment Initiative in Nigeria. Is a mental health activist. We thank you so much for your output today, and we are sure whoever has watched us from wherever you are, we have learned something, and I'm sure the journey is going to continue as we fight this. So thank you so much, and I wish you a lovely evening, a lovely good morning, and a lovely good afternoon, wherever the world that you are.
Thank
have
you.
a good night. Have a good night.
Thank you. Bye. Okay. Thank you.